Hi, guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, I always like to go over my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 42-year-old female presents with fatigue, weight gain, constipation, and cold intolerance. On physical examination, she has dry skin, a slow heart rate, and puffiness around her eyes. Lab results reveal a TSH level of 8.0. The normal range is zero point 0.4 to 4, and a free T4 level of zero point 0.6. Normal range is zero point 0.8 to 1.8. What is the most likely diagnosis? Is it A, subclinical hypothyroidism, B, primary hypothyroidism, C, secondary hypothyroidism, or D, hyperthyroidism? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most likely diagnosis? Y'all know what I say. If it's asking for a diagnosis, you need to run it back and look at the assessment findings. So here it states a 42-year-old female presents with fatigue, weight gain, constipation, and cold intolerance. So, we're starting to think of thyroidism, right? And I always tell y'all to think of hypo and hyper. With hyperthyroidism, I tell y'all, Brittany's brilliance, to think of someone hyper. They're racing, their heart rate is up, they're sweating because they're running, 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 brittle hair, all the things. Whereas hypo is low and slow, so they have the weight gain. It's the opposite, right? Their heart rate is low, bradycardia, Um, and so this, we're looking at more hypothyroidism. Now, with the lab values, you want to confirm and see if that is even adding up to what you think, right? This is why we look at those diagnoses. So our TSH level is 8, and sometimes boards will provide the lab values normal range at least once. So that's why I have it here to kind of give you that example. But normal range is zero point 0.4 to 4, right? So what is this showing you? That the TSH is elevated. And then the free T4 is zero point 0.6. So looking at the normal range, it's low. So this confirms hypothyroidism because remember, again, Brittany's brilliance, your TSH level is going to be opposite of what the term means. So hypo, we know, means low. So the TSH is going to be elevated, right? And the T3 and T4 will match the term. So you see the T4 is low, and that matches what the term means, hypo, okay? So this is confirmation this is hypothyroidism. So your best answer is B, primary hypothyroidism. Secondary, you can cross that out. You can cross out hyperthyroidism. Now, subclinical hypothyroidism, how would that have looked? Same concept, same scenario, but with subclinical, the TSH levels would have been elevated, but the T3 and T4 would have been normal. So I always tell everybody to think of subclinical almost like pre-hypertension, pre-diabetes. Like we're seeing that abnormality, but it's not the complete abnormality on all spectrums. So I just say, just think of it that way when you're trying to categorize what subclinical hypothyroidism is versus primary in your mind, okay? But here again, the best answer is B, primary hypothyroidism. Question number two, a 55-year-old male with newly diagnosed hypothyroidism presents for follow-up after being started on levothyroxine. He asked how long it will take to start feeling better. His TSH level at the initial visit was 6.5, and his T3 and T4 was low. That don't say nothing about T3, but my brain went straight there. But free T4 was low. What is the expected timeline for symptom improvement after starting levothyroxine therapy? So let me read that one more time because I butchered that. A 55-year-old male with newly diagnosed hypothyroidism presents for follow up after being started on levothyroxine. He asked how long it will take to start feeling better. His TSH level at the initial visit was 6.5 and free T4 was low. What is the expected timeline for symptom improvement after starting levothyroxine therapy? Is it A, improvement of symptoms typically occurs within 1 to 2 weeks? B, improvement of symptoms typically occurs within 4 to 6 weeks? Three, symptom improvement is gradual and may take 3 to 6 months. Or D, levothyroxine therapy should be discontinued after 1 month if no improvement is seen. Take a moment and tell me what you got, you guys. Tell me what you got. All right, so similar question here states, what is the expected timeline for symptom improvement after starting levothyroxine therapy? All right, so, and you really don't have to read anymore. This stem tells it all. Y'all, what is the time frame when you start levothyroxine, Synthroid, right? What are the typical expected timelines of seeing improvement in those lab values as well as in how they feel? And the answer is B. It's typically between 4 to 6 weeks, okay? All right, and question number three, a 60-year-old female with hypothyroidism is on a stable dose of levothyroxine. During a routine checkup, her TSH is 2.5 and her free T4 is within the normal range. She is asymptomatic and reports feeling well. How often should her thyroid function tests be monitored? Is it A, every 3 months until TSH is stable? B, every 6 to 12 months after stabilization of thyroid levels? C, every 2 weeks until symptom improvement? Or D, only if symptoms worsen or new symptoms develop? Take a moment and tell me what you get. All right, so similar question here states, how often should her thyroid function test be monitored? So this is a 60-year-old female with hypothyroidism, and she's on a stable dose of levothyroxine. So during her checkup, her labs are normal. TSH is normal, free T4 is normal. She's asymptomatic, she feels well. So how often should this test be monitored? And the answer is B, every 6 to 12 months. Once they are stabilized, TSH only needs to be monitored every 6 to 12 months, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. All of the things that I do offer are linked in the bio of this channel, to include the ebook and the paperback option of the review book. There's a self-paced review course for those of you who prefer to study independently with videos for each system for family and adult general board preparation for both exams. If you would like to do practice questions to test your knowledge and your application of your knowledge, my QBank options are linked there as well, and the digital flashcards also. And as always, if you're looking to book any of my one-on-one sessions, I always say to either call, text, or email, as I offer a variety of one-on-one session types, and I prefer to speak with you to gauge what you truly need to make sure you're booking the appropriate sessions, okay? All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.